Hi, Leila. Thank you so much for joining this special talk on Zoom. I'm very happy that you found time in Lebanon to talk to our followers about the situation in Lebanon and especially in the refugee camps in the south of Lebanon. Thank you very much for joining.
Thank you, Jessica, for having me.
So I think our followers or our donators would like to know how the overview situation is in Lebanon, especially in the camps. Can you give me a short overview of the situation that we have in Lebanon and especially in the refugee camps, please?
Yes, sure. Currently in Lebanon, we have around 673 cases of Lebanese people infected with the coronavirus. And we have around 21 deaths. The curve has started to flatten. We reached our peak around 3 weeks ago. And so, for example, today we've had maybe around just under 1,000 tested, and there was only one case. So we're seeing that curve flatten, and now also the curfew measures are going to be extended until from 7 a.m. to 8 p.m. instead of 5 p.m.
Okay,
So
that sounds very good.
Yes, in general, the situation is starting to ease up, and the government has recently announced that after May 10, they will start to ease the lockdown in several ways. So this is it's positive up till now.
That sounds very good. Very nice to hear.
Yes.
So in the past, since we have the corona all over the world and also in Lebanon, what are the challenges actually for you and the team in the Syrian refugee camps, as our schools in Lebanon are closed as well? So how do you manage to get to the students, and especially to get to those people, to the refugees in the camps, to support them with hygienes, tips and whatever they can do? How do you proceed in this?
Well, as you know, in the case of refugees, I mean, for both the Syrian refugees and the Palestinian refugees, there hasn't been enough done to tackle the coronavirus firsthand. What NGOs are doing now and what the humanitarian community in Lebanon is doing is mainly focusing on awareness and taking care of their own teams so they can then continue on with their programming, hopefully. So it's mainly focused on awareness and just kind of a protection mechanism to report those who want to be tested or to probably have symptoms, how they can report that and to whom they should go to for help.
Do you know about corona cases in the refugee camps?
In the refugee camps, no, because I mean, where we're working and with our communities, there have been none tested for corona, and none have been complaining of any kind of symptoms that are associated with the virus. And that's in the Sur government entire, where we work in South Lebanon. But it has been reported that 3 Syrians out of the 673 have had the virus.
Okay, but not really.
Yes.
They didn't go into the hospital. And my question is also, if they have symptoms and like heavy symptoms, like some people do have, I mean, how can they afford to go to the hospital? Is this paid, or how do you proceed with these problems?
In terms of the refugees, actually the UNHCR has created some kind of standard operating procedure so that if the virus spreads to the camps and to informal settlements, they would have a plan on how to deal with this and how to have isolation at different levels and stages for the community and for households.
But if they have to go to the hospitals, who is going to pay this?
If they go to the hospitals, I mean, currently right now, it's the UNHCR that is coordinating this with, I think, with other service providers as well with the Ministry of Health, of course.
So we have, from SWISS4SYRIA, we have our own refugee camps that we support, that we help. We started close in 2013. with donating clothes, and we opened actually 2016 the school. So how many people are actually taken care of in the south of Lebanon?
Yes, so our direct beneficiaries, which are the children that visit our school, they're around 150. And then you would have to say their families, which are indirect beneficiaries, would be around 750 all in all, because our interventions are in around 5 camps.
Okay, well, that's a lot. And how many kids will go back to school when it's reopens?
Hopefully all of them will go back to school, because they're really anticipating and keep on asking us when the school will open. Mm-hmm. What we've done now, currently under these circumstances, is that our team is always in contact with the communities and with the children. They've done a couple of awareness sessions on COVID-19 and how to detect if they have the symptoms, and how to do the basic hygiene, take precautions and basic hygiene measures. But that, of course, needs to be followed up with supporting them with protective equipment and supplies, and hygiene equipment, basically.
Okay.
So that's what we've been doing now. And as well, we will be continuing to do our literacy program, which is providing education within the camps for women who are illiterate. This is a project which we've also been doing in parallel with teaching the kids at school. But of course, we will be taking physical distancing into account. So 4 teachers will be distributed to households with around 3 to 4 women max, making sure that there's the proper distance between them, as well as, you know, the hygiene, hand gels, washing hands, all of this, and they will be teaching them how to read and write in Arabic.
That's amazing. I think we started with this literacy program for the women in the camps 2 years ago, or almost 2 years ago. And I think actually that's great that you guys restarted, or will restart this Monday in a very minimum way, with people to not forget the women who do not know how to read and to write. So I think that's a great idea, that to restart before the school will reopen. So these are actually great news. Thank you so much for this.
Yes, yes, it is.
So as we hope that the schools in Lebanon are going to reopen, you think you will have all the 180 kids coming on one time, or will we do like separate or half classes, third classes? What do you think will be the challenges there?
I think that once the curfew is taken out completely by the government and we're done with the lockdown and we have the green light to open, we will of course be incrementally bringing the students back, but we need to make sure that we don't have overcrowdedness within the school. Mm-hmm. This is very important, because sometimes you know that the number of students fluctuate according to different circumstances and obstacles. Sometimes we have many students who come in with their siblings, and because we have an open door policy and we don't reject anyone, sometimes the community center or school has the potential to become overcapacitated. So this time we have to make sure that we don't face any overcrowding within the classrooms, and we carry out the proper hygiene measures. We've already trained our students to do the proper hand washing and how to even brush their teeth. I remember the toothbrushes that had been donated also from SWISS4SYRIA, and we taught them all of these hygiene practices. But now we just have to reinforce them once again and ensure a bit of that physical distancing takes place during learning.
Okay, you told me something. We know our school is a community center, and it's also a kind of a protection for many children, and also for traumatized children. Do you think there have been more violence in the camps? Especially, I mean, if you even imagine in Europe or in the Western countries where you have little apartments, we heard that some violence have been unfortunately been in the families. So you think that there have been more in the camps? Because as you know, they're like on 20 square meters, 10 people living in a small tent. Did you hear anything about harmed?
No, I'm sure that, I mean, in Lebanon also, there's been many domestic violence cases reported, even among the Lebanese population. So also in the camps, I mean, given the fact that they're facing so many challenges, now we have the livelihood, their livelihoods have really been here affected. Because they haven't been able to work like they usually used to work in this circumstance under Corona. So it's a lot of pressure on them. And at the same time, you have the kids not going to school. So of course, they're exposed to more abuse and possibly the pressure to go out and find work and possibly beg on the streets. And all of this. So that's why our community center / school, because it's a protective space before anything else, it's very important that hopefully, we hope, best case scenario is that after they ease the lockdown after May 10, we are able to reopen the school and have the students back there. Because that gives time for their parents to work, to go out to work. Mm-hmm. And it's also a space where the kids are learning in a healthy environment and they're not always exposed to that kind of abuse, or maybe not having their parents being able to take care of them because they have to work.
Which just occurs to me that we have a new project coming up in September, October, which is the special needs school for how do you say, for traumatized children from Oberwallis für Kinder unserer Welt. We have kicked off already, and we will start now building up a second class or a second school. It depends how many children we will have to take care. What are the next steps to start the school? We have our school, like how many rooms? There are like 3 classrooms, 4 classrooms.
Yes, we have 4 classrooms.
We will integrate this school, the upcoming school from Oberwallis für Kinder unserer Welt, I hope in September. You see light on the horizon, so that we
yes, definitely, because we're always in as I said before, we're always in close connection with our communities, and we already know those kids that have specific learning difficulties and who have some special needs, learning needs, because we're not going to be dealing with any physical disabilities. It's not in our capacity. Mm-hmm. So and as you well mentioned, the aspect of trauma that plays a role in them not being able to learn. Mm-hmm. So hopefully we already have listed a number of children who need this kind of support and help, and we're in close contact with their families, and we will be ready to start. It's just a matter of recruiting the special needs teachers. Mm-hmm. Getting them on board, and then setting the program, which we can hopefully do by this summer, so we can launch the school in September.
That's actually a beautiful and a great perspective. Thank you so much. Inshallah, it's going to work.
Inshallah.
These kids really need a lot of help and education, which they lost for the moment. But
definitely.
Leila, for the last sentence, what came up to your mind after or still in Corona? What really triggered you the most during this time? If you can give me a short feedback on that, what came up to your mind within these times?
Well, honestly, Jessie, it's been a very difficult time for us, as you know, for all Lebanese and for all foreign communities and families living in Lebanon, because the lockdown has really locked us down in every single way, and we've really gone back to the basics with our families and kind of working from the bottom up. As you know, Lebanon is also facing a severe economic crisis. So that in parallel with the COVID-19, it really just makes you think about what matters. And it's just really our health and being able to meet our basic necessities. I mean, this is where we're all standing very equal as citizens, dealing with the same challenges. So I think that we just need to, it's just allowed us to kind of slow down. We are very resilient, as you know, the Lebanese are, but at the same time, it's allowed us to slow down, go back to the basics, work from bottom up, and realize what really matters and what's important, that we're all in this together.
Thank you so much. That's a very, very important message you just sent me and to our followers. Thank you so much. Leila, I really wish you all the best. I know Lebanon is a very bad situation. We from here try to help in any kind of way. We try to help with Swiss for Syria for the children of Syrian refugees. We also try to help with Swiss for Lebanon for the Lebanese, for their education, for their help, and for their food. So thank you so much for being with us since the beginning, since 2013. Without you and our teachers and the Mukhtar in Lebanon, we wouldn't be here where we are. And this is also a big thank you to the donators who support Swiss for Syria so for many years. And I hope we will continue this great journey with you guys and everybody who takes care of this. Thank you so much. And a big kiss to Lebanon. And I really hope to see you very, very soon again. Thank you so much.
Thank you so much, Jessica, and to all the supporters and the donors. Thank you so much.
Great. Thank you. Bye, Leila.
Take care. Bye.
Bye. Bye.